Welcome back to The Explainer. I am absolutely thrilled to jump into this today because we're looking at some of the most incredible biological engineering on the planet, which is, of course, the human body. Specifically, we're going to break down the profound invisible mechanics that literally keep us alive second by second. We're talking about fluids and electrolytes, but more importantly, we are going to master the core principles behind them. Because, when you understand the underlying rules of how the system works, you stop just memorizing random medical facts, and you actually start predicting exactly how a patient's body is going to behave.
So here's our agenda for today. We're going to start with the body's balancing act, then move into the rules of fluid movement and explore the three fluid types. After that, we'll cover safe venous access principles, tackle electrolyte balance and imbalance, and finally wrap up by putting these principles into practice.
Okay, Section 1, the body's balancing act.
To start us off, we absolutely have to establish the foundational concept of everything we're about to discuss. Human survival depends entirely on a constant, unyielding state of homeostasis. Think of it like a high-stakes balancing act on a literal scale. Keeping a human being healthy isn't some static achievement, it's this constant battle between water on one side and electrically charged particles on the other. I mean, every single breath you take, every drop of sweat, every metabolic function, it's all constantly threatening to tip this scale. Your body's core principle of survival is fighting tooth and nail to keep that exact equilibrium.
Moving on to Section 2, Rules of Fluid Movement. So how does the body actually pull this off? Well, a healthy adult human body is roughly 60% water, but that water isn't just sloshing around randomly inside of us. It is strictly partitioned into compartments. You've got intracellular fluid, that's the fluid packed tightly inside your cells, and extracellular fluid, which is outside the cells, including your blood plasma. And what's really fascinating here is that the particles and the fluids are constantly shifting back and forth across those semi-permeable cell membranes, just desperate to find equilibrium. And that brings us to what is probably the most important definition you're going to hear today: osmosis. Water moves from a lower solute concentration to a higher solute concentration. Really, the best way to think about it is just imagining water actively chasing the particles. If there's a massive party of salt and electrolytes on one side of a cell membrane, the water is going to rush right over to that side to dilute the crowd and bring everything back into balance. Grasping this simple core principle of osmosis, it's the singular key to understanding all fluid therapies.
Which takes us to Section 3, the three fluid types.
Now that we have the physical rules down, let's see how we purposefully manipulate this rule of osmosis to save patients' lives. First up, isotonic solutions. When you're dealing with isotonic fluids like 0.9% normal saline, red blood cells stay perfectly normal, healthy, and round. That's because isotonic fluids have the exact same solute concentration as human blood. The balance is already perfectly equal, so there's no net fluid shift. The fluid goes into the patient's veins and it stays right there in the vascular space. That makes it absolutely perfect for rapid volume replacement when someone is in shock. But what happens when we change the concentration? Take a hypotonic solution. This has a lower solute concentration than the patient's blood. Now remember our core principle. Water chases particles. Because the blood now has fewer particles than the inside of the cells, the water rushes into those higher concentration cells to balance things out, which causes them to dangerously swell. Now, this is a lifesaver if a patient's cells are dehydrated, right? But you would never ever use this if a patient had brain swelling. It would literally make the brain cells swell even more. Conversely, when we're dealing with a hypertonic solution, which is just packed with particles, we see the exact opposite effect. It's got a much higher concentration than blood. So when this hits the bloodstream, it acts like a giant sponge, pulling water out of the body's tissues and cells straight into the vascular space, causing the cells to dramatically shrink. Because this triggers such a massive and rapid fluid shift, a core safety principle here is that hypertonic solutions must be infused incredibly slowly to prevent severe brain damage. So putting this all together into a matrix really highlights why we focus on core principles. Mastering this means you aren't just memorizing which fluid bags to pull off a shelf. You are using physics to predict exactly how a patient's microscopic cells are going to physically react to your treatment. Isotonic stays put, hypotonic swells, hypertonic shrinks. If you know that, you know exactly what clinical warning signs to watch out for. All right, Section 4, Safe Venous Access Principles. Of course, to deliver these highly powerful cell-altering fluids, we need a way into the bloodstream. Getting intravenous access is a very highly specific procedure with strict sequential steps. You cleanse the site with an antiseptic scrub, use a tourniquet to enhance vein visibility, insert the catheter with a needle bevel up at a precise 10 to 30 degree angle, and finally, secure it flawlessly. The core principle here?
And where we actually place that doorway matters immensely. Site selection is a highly strategic decision. We want the most distal accessible vein, typically on the forearm. We specifically, intentionally avoid joints like the elbow crease, and we avoid the lower extremities entirely. Why? Because placing an IV near a joint massively increases the risk of it dislodging the second the patient bends their arm, and using the legs, that carries a much higher risk for dangerous blood clots.
If you don't follow those access principles, you get a direct and immediate consequence, known as infiltration. That's when a non-vesicant fluid leaks out of the vein and into the surrounding tissue. You'll visibly see a cool, pale, swollen arm. When you see this happen, the absolute first core principle of nursing action is to stop the infusion immediately, discontinue the IV, and elevate the arm. Stop the harm first, ask questions later. So we've mastered the fluids, and we've mastered how to safely deliver them into the veins. But let's pause for a second and ask a critical question. What actually happens when the particles suspended inside the fluid fall out of balance? That brings us to Section 5, electrolyte balance and imbalance. This completely pivots our focus to the tiny, electrically charged architects of our biology, electrolytes. These little ions dictate how our nerves fire, how our muscles contract, and how our hearts beat. Let's start with sodium. Sodium is the undisputed master of extracellular fluid balance. It basically acts as the primary dial for your overall fluid volume and your blood pressure. It is so absolutely critical that it's strictly regulated by the kidneys and vital hormones like ADH and aldosterone. Because remember, where sodium goes, water powerfully follows. Let's look at the two extremes to see what happens when things go wrong. On one hand, you have hyponatremia, low sodium. When sodium in the blood drops, water shifts into the cells, leading to incredibly dangerous cellular swelling, especially in the super tight confines of the brain. On the flip side, hypernatremia, high sodium. This almost always indicates a severe water deficit. The patient is profoundly dehydrated, and the blood has become overly concentrated with sodium. Because sodium so closely dictates brain cell volume, the core principle for intervention is crystal clear. If you have a severe sodium imbalance and the patient has an altered level of consciousness, your number one priority is always placing them on strict seizure precautions. You absolutely have to protect the brain from those massive fluid shifts while you work to correct the underlying sodium level. Now, let's talk potassium. While sodium rules the brain, potassium controls the heart muscle. Because of this, the absolute non-negotiable core principle of potassium management is continuous cardiac monitoring. And if you are giving potassium through an IV, you have to heed this warning. You never, and I mean literally never, give it as an IV push. It must be heavily diluted and infused slowly on a pump. Otherwise, it can cause instant, fatal cardiac arrhythmias. Finally, Section 6, putting principles into practice. We've covered a tremendous amount of ground today. But applying these core principles means you aren't just some passive observer reacting to medical alarms. You are actively managing the fundamental laws of cellular physics. Always trace a patient's symptoms back to that original scale, the balance of water and solutes. Remember that osmosis will always dictate how your IV therapies physically alter your patient's cells. Know that sodium threatens the brain while potassium threatens the heart, and realize that practicing incredibly safe venous access is what prevents these life-saving therapies from turning into localized catastrophes. I want to leave you all with this thought. Keeping a human body alive is essentially a high-stakes, continuous act of microscopic chemical balancing. Every time you look at a bag of IV fluids or analyze a set of lab results, you are carefully placing weights on the body's ultimate scale of survival. But it really begs the question, if this is just what happens with water and salt, what other invisible, microscopic battles are secretly dictating your health every single second of the day? Something to think about. Thanks for joining me on this explainer, and I'll catch you next time.